This is our project on pediatric asthma.
Asthma is an obstructive airway disease usually characterized by chronic airway inflammation resulting in bronchial hyperresponsiveness, bronchial constriction and edema, thickening of bronchial walls, and the production of thick mucus. Although the cause of asthma is unknown, it appears to be the result of innate immunity, genetics, and environmental factors. Asthma can occur at any age. Complications include respiratory failure, status asthmaticus, persistent hypoxemia related to asthma can lead to respiratory failure. Status asthmaticus is a life-threatening episode of airway obstruction that is often unresponsive to common treatment. It involves extreme wheezing, labored breathing, use of accessory muscles, distended neck veins, and creates a risk for cardiac and respiratory arrest.
Long-term control medications for asthma include inhaled corticosteroids, Flovent, Discus, Flexhaler, Asmanix, Alvesco, and others. Leukotriene modifiers, Singulair, Accolate, Zyflo, combination inhalers. These medicines contain an inhaled corticosteroid plus a common-acting beta antagonist, LABA. They include fluticasone, medications. Types of long-term control medicines include inhaled corticosteroids, such as Flovent, Discus, Pulmicort, Flex Inhaler. Others include leukotriene modifiers, Singulair, Accolate, and Zyflo. Combination inhalers. These medications contain an inhaled corticosteroid plus a long-acting beta antagonist, LABA. They include Advair, Discus, Symbicort, and others. This is a daily pill, theophylline, which is otherwise known as Theo24. It's used to help keep the airways open. Immunology agents such as Nucala, Dupixent, and others may be appropriate for children over the age of 12 who have severe levels of WBCs, and can be considered for children age 6 or older, Zoclair, for those that have moderate to severe allergic asthma. Inhaled medicine devices. Inhaled short and long-term control medicines are used by inhaling a measured dose of medicine. Older children and teens might use a pressurized meter dose inhaler or an inhaler that releases a fine powder. Infants and toddlers need to use a face mask attached to a meter dose inhaler or nebulizer.
Treatment for allergy-induced asthma. This medication is for people who have allergies with severe asthma. It's delivered by injection every 2 to 4 weeks. Allergy medicines such as oral and nasal sprays, antihistamines, and decongestants, as well as corticosteroids, cromulin, ipratropium, nasal sprays. Allergy shots, also called immunotherapy. Immunotherapy injections are generally given weeks for a few months, and then once a month for a period of 3 to 5 years. Over time, they gradually reduce your child's immune system reaction to special allergens. Common adverse effects. Short-acting beta agonists and long-acting beta agonists cause tremors, tachycardia, insomnia, headaches, nervousness, and anxiety. Combination inhalers such as Advair or Dulera can cause risk for pneumonia in some patients. Inhaled corticosteroids cause thrush, throat irritation, voice change, and cough. And oral medications can cause mood changes, stomach pains, and elevated sugar prednisone.
Some severe side effects that happen with SABAs or short-acting beta agonists, such as albuterol, would be severe palpitations or arrhythmias, chest pain, severe hypertension or hypotension, some bronchospasms. For LABAs, increased risk of asthma-related death if used alone without a corticosteroid, serious heart effects, tachycardia, arrhythmia, or worsening asthma symptoms if overused. Inhaled cortical symptoms such as fluticasone, a severe oral thrush, fungal lung infections, adrenal suppression when used in very high doses, leading the body to not produce enough cortisol, bone loss, osteoporosis with long-term use, cataracts or glaucoma with prolonged high doses. Combination inhalers such as Symbicort increases the pneumonia risk, a higher risk for severe asthma attacks if overused. Oral medications like Singulair cause psychiatric effects such as depression, suicidal thoughts, aggression, or hallucinations. Toxicity is rare, but it is serious. Watch for jaundice, abdominal pain, or dark urine. Anaphylactic reactions are also rare, but can happen. Oral steroids such as prednisone, severe adrenal insufficiency if stopped suddenly after long use, Cushing's syndrome, weight gain, high blood pressure, and skin changes, severe mood changes, nebulizing medications, high doses of albuterol treatments cause severe tachycardia, severe tremors, or seizures.
There are several labs and diagnostic studies that can be done as well. There's breathing labs, blood tests, and allergy testing. Some breathing tests are the spirometry. This measures how much air you can inhale and exhale. There's a peak flow test. It's a handheld device that measures how quickly you can exhale. There's a pheno test. It's a nitric oxide inhaler that measures the level of nitric oxide in the breath, which indicates inflammation in your lungs. There is a bronchial provocation test. These measure how sensitive your lungs are to irritants like allergies or chemicals. Some of the blood tests that are done is CBC. This can help assess the risk of mortality in people with asthma. There's eosinophil tests. Some of the allergy tests are a blood test, scratch test. They can identify allergies that trigger the asthma. There's a sputum sample examination where a patient coughs up the mucus sample, which is then examined under a microscope.
Nursing interventions, assessment and breathing support. Regularly assess the child's respiratory status, including breath sounds, respiratory rate, and oxygen saturation levels. Keep track of peak flow readings to monitor the severity of asthma. Administer oxygen therapy as needed. Encourage effective breathing techniques such as pursed-lipped breathing. Medication administration. Ensure the child receives the prescribed medications such as bronchodilators, such as albuterol and corticosteroids, fluticasone, or in severe cases, prednisone. Educate the child and parents on proper use of inhalers and spacers. Educate on how short-acting and long-acting inhalers and steroids work. Education and family support. Teach the child and family about asthma triggers and how to avoid them. Provide guidance on recognizing early signs of an asthma attack and the importance of having an asthma action plan. Ensure parents know when to seek medical attention. And hydration and nutrition. Encourage fluids to thin secretions. Monitor for dehydration, especially in severe cases. Provide small and frequent meals or snacks.
All right, so for patient teaching, so you want to know and avoid the triggers, so like allergens, irritants, or infections. So if you're like out at the park or under a tree, you want to make sure you know where you are and your triggers and avoid them. And you want to recognize symptoms. So the first signs usually like hives. So other signs are wheezing, coughing, shortness of breath, or chest tightness. And then the treatment as well is very important to know the treatment. So a rescue inhaler is one thing you should really be familiar with. It's used in emergencies, and then long-acting medications, coverage for like a good majority of the day, like salmeterol, is used for daily control. And these right here are our references. And yeah, thank you everyone.